Hello, everyone. This is Dr. McElhenney recording ILGS for Monday, the 24th of February, 2025. And I'm sorry we don't have a better time to do this week. And as always, I really want you to understand what we're doing here. So after you watch this ILGS and take notes and review your notes from class and PowerPoints in the textbook. If things still aren't clicking, I really want you to contact me. You can call me on the phone. My office number is listed on the syllabus and in Canvas. You can shoot me an email and you can see me before or after our class on Wednesday. Remember that Monday, the 4th of March, I think it's the 4th anyway. Let me check. I'm sorry, it's the 3rd of March. Monday, March 3rd is our second exam in this part of the class. So, what I plan to do today, you see on your screen, is the clinical judgment model that you're probably familiar with from clinical. Today, I want to show you just a short example of how you can use this tool to help you study for the upcoming exam. Just as a reminder, the content in the exam will focus primarily on, let's see, newborn complications, complications during delivery, complications during pregnancy, antenatal care, and women's health care. You can apply this tool to help you study, and I'll show you what I mean by that. So if we were all together, I probably would have handed each of you who attended one of these sheets, and each of you would have chosen your complication of choice and had a few minutes to work on it before sharing with the group. And I've done this with other ILGS, usually around this time to help you prepare for the upcoming exam. Today, I thought since we really didn't talk about gestational diabetes very close, very in depth in the class at all, I thought that I would do the clinical judgment model on gestational diabetes. Now, here's where the study habit comes in. Make copies of this sheet, or use a digital copy and fill it in one color of ink. Don't look at any of your notes. Don't look at any of the PowerPoints. Don't look at the book. Just try to fill in everything you can remember that you've learned about the complication. Then afterwards, after you're done filling all of the boxes in, then go back and check your textbook, check your notes, look at my narrated PowerPoints. And then you can fill in the missing information in a different color of ink. Now, the original color of ink, you won't really have to study because you already remember those things, but it's the different color ink that you'll want to spend some time on. So I have to give credit where credit is due. That study technique is from Mrs. Wansey, and she'll probably be sharing you with that in the second half of the course. All right, so to get started, we're going to do this on, I don't know whether I can do this or not, gestational diabetes. Okay. So, what do we know about gestational diabetes? Well, I know, what am I going to assess when I assess a patient? Well, in this box, this first box here, I don't know whether you can see my cursor or not, but this recognizing cues box, you will want to put your nursing assessment. Everything in your nursing assessment goes in recognizing cues. You want to put signs and symptoms. You'll want to put your head to toe assessment, the patient's history. Everything goes in that box. The next box, so like I'll head to toe assessment, history, if I could spell, um, subjective information, what they tell you, and maybe I have to pee all the time and I'm always thirsty. So all of that stuff, normal, abnormal, all that stuff goes into recognizing cues. Once you collect all your data, you want to analyze your cues and your concerns. What out of all of the data that you collect, what supports the hypothesis over here on the right for gestational diabetes? Okay. And what's concerning? Okay. So supporting might be, of course, my cursor is not going where I want. Uh, Glucose, let's see, finger stick, glucose, uh 175. Fasting, oops. See, I'm not going to be able to do what I want here. Maybe also in here, fasting is 120. Polydipsia, like they drink a lot. Polyuria, yeast infections. What might be concerning might be decreased fetal movement. Um, Large for gestational age, LGA, or measuring large for dates. So go try to think of all of the things that would be abnormal for a patient that had gestational diabetes. Something else up here, patients who are obese, it puts them at higher risk for gestational diabetes. Oh, how about glycosuria? So positive glucose in urine dip. Um, Maybe they have a history of gestational diabetes in a previous pregnancy, or a history of a large for gestational age infant, maybe a stillborn. So something that's very concerning might be decreased fetal movement or measuring large for dates. All of these things here then support that hypothesis for gestational diabetes. And of course, let's see, GDM. But it could also be fetal distress if they're not feeling fetal movement. Let's see, maybe they're just dehydrated. That one might not fit because if they have glucose in their urine, that really just doesn't fit so well. But definitely diabetes would fit with all of those supporting and concerning cues. So once you get a diagnosis, and we're going to run with GDM, gestational diabetes, then you'll want to fill in the disease process and the pathophysiology and the risk factors. So risk factors are obesity, hypertension, glucose in the urine, older gravidas, older than 25. If they have a family history of diabetes, or if they've had a previous baby that's large for gestational age, you would want to look into the disease process and the pathophysiology. We know that there's an elevated blood glucose level when there's not enough insulin to transport the glucose over the cell membrane. And over time, that can affect many, many other organ systems. And you'll learn more about diabetes, juvenile diabetes or type 1 diabetes with Mrs. Wansey in the second half of the semester. You'll learn more about type 2 diabetes with Mr. Smith in the fall. So I'm not going to really get into the weeds here because it's coming. But just know that insulin is required to transport that glucose across the cell membrane. And if that's not happening, the glucose is going to build up in the blood. Okay. So what do we want to begin with for our patient goals? Remember, these should be SMART goals. So they're specific, measurable, achievable, or realistic and time bound. So think about patient will have a fasting glucose um, uh, tomorrow morning. Patient will have finger stick blood sugars that are within normal limits 4 times a day. Patient will consume okay, let's do this. Patient will verbalize foods that will not result in a higher blood sugar. So we would want them to eat more proteins, more complex carbohydrates, so that their blood glucose level doesn't spike with the simple carbs. And you'll continue with that. The other thing I want to add here, patient, oops, let's go back. Patient will verbalize understanding of daily kick counts. That's really important for fetal well-being, especially with patients that have any complications. I'm going to make this a little bit smaller so that we have room. Let's see, what else would we want them to do? Oh, patient will verbalize signs and symptoms of hypo and hyperglycemia. So really important to then, let's make it even smaller so that you can see the whole thing here. So from these patient-centered goals, then what will the nurse be doing? And what's the most important thing for the nurse to do? So why don't we think about this? Oh my goodness. Okay, so we have to think about airway, breathing, circulation. And we have two people to think about here. We have to think about the pregnant person and we have to think about the fetus. So, of those five SMART goals, what do you think would be the most important thing if we're thinking about airway, breathing, and circulation? So, I hope you picked kick counts. Nurse will teach how to do kick counts. That's one of them. Okay. Nurse will teach. Let's think about the next one then. What one could cause more trouble than the other four? And I hope you picked signs and symptoms of hypoglycemia, because if they get hypoglycemic, then they don't have enough blood, sugar in their blood, energy in their blood, and they could pass out and go into a coma and die. So I definitely want to teach about hypoglycemia. Hypoglycemia. And if you're doing that, may as well teach hyperglycemia too. Um, After that, let's see. I'm not sure what I would want next. I think I would do the fasting blood sugar next, and then fasting less than 90. Oops, I'm having trouble with formatting here. I'm sorry. And then QI. So we would the nurse will teach how to do finger stick blood sugars. How about that? Here's another one that's important. Now, we want the patient to have fasting glucoses, and we want them to have all of their finger stick blood sugars that are within normal limits. So, the nurse will teach how to log blood sugars, finger stick blood sugars. And then um, the nurse will refer to dietitian. Nope. Or will teach appropriate diet. All right. And I hope that makes sense. You want to go from the most acute to the least acute, or, ABCD, airway, breathing, circulation, disability, Maslow's hierarchy of needs, acute before chronic, and so forth. And I hope that you got some of that information in level one. So once we do our actions, when we take actions, then we have to make sure that those actions worked. So how will we know that the patient knows how to do a daily kit count? Well, they will probably they will uh, perform a return demonstration for kit counts. How about successfully? And then maybe um, successfully perform a finger stick blood sugar. Um, Verbalize signs and symptoms of hypo and hyperglycemia. Verbalize the correct. How about that? Then how about demonstrated appropriate finger stick blood sugar and logging procedure. And then the last one, maintain food journal and has low simple carb consumption. So this is one way that you could go through this whole complication and really try to pull out everything you know, everything you remember about that particular complication. This one was gestational diabetes. I got some of the information from the PowerPoint presentation, some of that information from the textbook, And then some of it you might have to kind of think about, like what are some appropriate nursing interventions for that particular abnormal value. So try to do this with all of the major complications. You'll want to look at the slide decks from newborn complications, maybe do one on necrotizing enterocolitis, uh, respiratory distress syndrome, neonatal abstinence syndrome, sepsis, and maybe some congenital anomalies. But go through the slide deck. I'm sure I missed a few. You'll also want to maybe do some on the labor complications or delivery complications, like prolapsed cord or shoulder dystocia, and instrumented delivery. And there are others that you might want to include. And these every time you do one of these clinical judgment model maps, you're reinforcing the content. And again, try to do them without looking at your notes, without consulting any reference material, and then go back with that new pen color, a different pen color. Then you have your study guide. You just really need to look at the different pen color on all of these sheets. Moving on into the pregnancy complications, we did the gestational diabetes one together. And what I'll do is I'll post that for you. And let's see, preeclampsia or the gestational hypertension spectrum, molar pregnancy. Oh my goodness. Any of the bleeding disorders like placenta previa, abruptio placenta, spontaneous abortion. They're all in that slide deck, and I'm sure there are other ones that are in there that you could complete this on to help you get a good idea of what you need to study. You could look at your antenatal slide deck and just with the infections perhaps and look at that. And then you might want to complete the ones on the women's health from the last two slide decks and from our active learning activity that'll happen on Wednesday. So I hope this was a helpful exercise. I hope you'll be able to apply it, not just in this class, in this part of the class, but in the pediatric part of the class, and then moving forward into levels 3 and 4. Using this clinical judgment model is going to help you really start thinking like a nurse. So the more you use it and the more practice you use with this clinical judgment or critical thinking, the easier it becomes. All right, everybody. I hope it was helpful. As always, let me know if you have any questions, and I hope you have a great day. Bye-bye.